With this wrap, you can listen to the cat's heart. You can also palpate the cat's abdomen, and you can examine the cat's rear end, do a cystocentesis, or take blood from the rear leg. First, watch how the wrap's performed. I'll show it first at normal speed, and then I'll show it again at a slower speed so that you can join in. I'm going to start with the cat in the center of the towel, so center. And I want enough towel that I can put over the cat's head. I'm going to have to hold the cat in place because if I'm not holding, the cat will just take off. So I'm holding the cat in place. My hand is behind the neck, and the cat can't back up. And also my body is against the back of the cat, so it's not as easy for the cat to back up. And then I'm going to fold the towel over the head, and I can hold the towel with my thumb here. I'm going to fold the towel all the way across. From here, I'm going to wrap this side over. And I want it snug, but I don't want to tighten it like this, like I'm tightening a corset. Snug, but not uncomfortable. Then from here, this arm is holding the cat in place. I'm going to remove the lower arm here, tidy up the towel, and then from this side, I'll wrap the towel over. Again, I want it snug so the cat doesn't feel like it should move around a lot. However, I don't want to tighten it like a corset. And then from here, I can just wrap it under. And so you can see that it's snug in the front, but there is breathing room. And it's snug on the side, but it's not so tight that it's difficult for the cat to breathe. Now join me as I break it down into steps that you can follow. So we'll start with the cat, stuffed animal, in the middle of the towel. So here are the ends, and we're about the middle. And we want enough towel to cover the head. We also want to make sure that you're controlling the cat so the cat doesn't leap off the table. So I'm going to need to keep my arm on the cat. I need to keep the cat from backing up, so my body is against the back of the cat, and my fingers are behind the neck, the head and neck. So the cat can't really back up easily. And my arm is all along the cat, helping to hold it in place. Now I'm not squeezing the cat down, because if I have to squeeze the cat down like this, then this is not an appropriate wrap for the cat. I'm just keeping even pressure to encourage the cat to hold still. Now I'm going to fold this over the cat's head. Again, I'm not going like this because I do not want to suffocate the cat. I'm just folding it snugly over the head. I'm going to wrap this side up. And then I'm going to use this hand to hold the cat in place while I remove the other hand. So my arm is along the cat. And now I'm going to wrap this side over. And then my one arm is still on the cat, and I need to switch, so I'm going to place the other arm on top and remove the bottom arm. And then from here, I can wrap around again. Now let's see some lab participants trying this wrap. Watch to see what they're doing right and what needs improvement. This participant is controlling the cat well to start. But here she needs to switch arms. She needs to place her right arm on top of the cat so that she can snug the towel down and then use her left arm to pull the remaining towel over the cat. This wrap is too loose. This workshop attendee gets the arm switch. But it would be better if more of his arm were parallel to and on top of the cat. This handler has switched his arms correctly, but isn't controlling the cat. Look at the airspace between his right arm and the cat. His right arm should be lying against the cat's back, and his right hand should be right behind the cat's head. This handler's supporting arm is in the right place, but she has her hand on the cat's head, and it should be behind the cat's head. This handler needs to wrap the cat more snugly. You can see the towel loosening here. The cat's rear legs are also protruding out the back. Here the handler's arms should be parallel to the cat's back to help control it, especially since the wrap is loose. Once you have this wrap down on a stuffed animal, you're ready for the real thing. Remember that the goal of this wrap is to use it on cats who like to hide because it helps them feel comfortable and safe so they won't struggle. I'm going to start with the cat in the center of the towel, and notice that there's room behind to pull the towel up behind, and there's room to pull it over his head. So notice I'm holding him in place here, and then I'm going to wrap this over his head. I switched hands, but I'm still holding him. Wrapping one side over, and it should be snug. And then I'm going to go ahead and wrap the other side over. And again, it's snug. And then I can wrap it one more time if I want. So it's pretty snug, but it's not pulled super tight. And he has room up here to breathe. His nose is actually down here. And from here I can do an examination and control him myself, or I can have somebody else place their hand right here, which is behind his head. From here I can examine his rear end. So you can see his tail, his rear end. If I loosen it, I can also get to his abdomen. So I can reach in and I can palpate his abdomen from here. From here we can trim the hind nails. I can palpate his abdomen. I could do a cystocentesis. And we could draw blood from the hind limb. And notice I'm using my arm to help support the cat. Remember to reward your cat in between for letting you practice with him. Now let's see how lab participants did on a real cat. This technician should have her arm on top of the cat instead of on the side so that the cat doesn't try to stand up. This time she has her arm over the back, but it's not quite centered, so the cat easily wiggles loose. Sometimes, even if your arm and body are positioned correctly, the cat struggles and wiggles a lot. When that happens, you should try a different wrap or a different restraint method altogether. You may even need to sedate the cat. It's important to avoid handling in ways that will increase the cat's level of stress, because once the cat becomes highly agitated, even sedatives may not work. This wrap is done perfectly. The intern keeps one arm over the cat's back at all times. It also helps that the cat is a perfect candidate for this wrap. This is the kind of cat who likes to hide. Because the cat's head is covered in this wrap, remember the following. Make sure the wrap has some room at the front for the cat to breathe. Be sure to monitor the cat's respiration and pulse, especially if he's going to be wrapped snugly for more than a couple of minutes. And note that you can loosen the wrap for various procedures once the cat's relaxed.